But I'd like to ask maybe Kristin and Daryl to share some of your thoughts on sort of how the MRT funds are sort of changing the way that you're doing business and how it's sort of working with your programs.
Sure. The Office of Temporary and Disability Assistance has been very fortunate to receive MRT funding for a number of purposes, including both capital development and supportive services, and also some demonstration projects that are now underway related to rental assistance subsidies for elderly and disabled individuals who are among the highest cost Medicaid users, who are also homeless. And so I think through these demonstration programs, one of which has just expanded in the city, we will begin to see real opportunities and real results that hopefully can be replicated in other parts of the state and taken to scale and potentially rolled out to other parts of the Medicaid population as well. And really I think it's the key of the development of the units with the MRT funds and then the ability to operate those with as rich and robust a set of services as the particular target population needs at any given time. And also the ability to be flexible in recognition that, not every elderly individual who's on Medicaid who happens to be a high-cost Medicaid user is a high-cost Medicaid user for the same reasons. So it really is a very targeted approach. Health homes is a key part of being able to make this truly individualized managed care. It's not just fiscal managed care, it really is case managed care so that people are getting not only what they need, but at the right time in the right sequence. For some people, housing is a real key to having that stable place to live so that they can better adhere to medication regimens, get to medical and mental health appointments on a regular appropriate schedule and those sorts of things. But really, I think one of the great opportunities that I see with the MRT resources is to be able to target what an individual needs at a particular point in time, and to recognize that those needs will change, and that we need to have the flexibility to address those needs as they do change and evolve, and potentially the needs will diminish over time if it's successful. And the other part I'll just come back to here is the real importance of data collection and performance measurement so that we have real information that we can take back. I think Jason is much more aware of this, and at times he's been acutely aware of it, but New York is an outlier in many ways, and Bill alluded to some of those ways earlier, and those are all very positive ways for us because we're New Yorkers, but sometimes New York stands out in the nation to people who are from other states and elected officials who are from other states, and they don't necessarily see New York in the positive light that we see New York. And so that data collection and those performance measurements and really being able to document tangible outcomes, I think are a particularly important element for all of the agencies represented here, and also for you as our partners, so that we can make sure that we can not only sustain the resources but obtain additional resources to continue this work.
We know we're doing good, we got to prove it to everyone else, right?
Yep. From our perspective, I think that it is more about leverage. With the $32 million in MRT capital, we've been able to leverage it in order to have an impact of $317 million. A lot of that is due to the creativity of the staff, really knowing how to utilize these resources. But of the 12 HFA bond finance projects that we have in our pipeline currently, 7 are in construction or will be in the end of this month. These 7 deals were awarded approximately $32 million from the MRT and have leveraged $137 million in tax-exempt bonds, $110 million in tax credit equity, mostly the low-income housing trust and state low-income housing trust, and also has leveraged $24 million from our other colleagues at state agencies, as well as $45 million from localities, mainly HPD. So the opportunity to have this resource has given us the opportunity to leverage and do even more. Again, it's because of the creativity and cooperation that we've been able to stretch this resource. But it just shows the ability that we have when we have this MRT pool to deal with.
Great, thanks. So, we have to be honest that, MRT scares us, or Medicaid redesign scares us all a little bit. And Olmstead, which is also on everyone's mind, scares us a little bit as well. So I'd like maybe to drill down that and we've talked about it on the panel so far. I'd like to drill down a little bit on that. It's sort of how does supportive housing helping the state meet its Olmstead objectives? How do we stop making this feedback? No. And how might Olmstead change supportive housing? So Jason, Bob, maybe sort of taking a shot at that question?
Sure. First thing, I think when you look at Olmstead and the Americans with Disability Act, it's a wonderful thing. It's a wonderful thing for public policy, and I think it's a federal law that under the current administration, the Justice Department is really driving, and now so is CMS and so is HUD. So that's a good thing. That the values are good, community inclusion is good, community integration is good, segregation's bad, stigma. So and no matter how good you are, I think it doesn't hurt to be pushed. And I think that's what Olmstead does, and I think that's what the ADA does. There's always forces, there's always countervailing forces in government that try to push the other way, and I think the fact that we have ADA and Olmstead out there is driving us. I think it was a real driver for the real positive outcomes we got in the adult home and the nursing home settlement, for example, which this has been in state government a long time, and 2 other times I worked on those issues and weren't able to get there, and this time we did, and I think part of it was the Justice Department was at the table. So that said, now how do we work with that? And besides that, with CMS, there's this final rule that was referenced earlier today, which again I think is the values there are very positive around community inclusion. And when you look at it, they're going to apply that not just to housing, but they're going to apply it to employment, and they're going to apply it to day programs. Very serious about integrating folks in care. Now I think the challenge is working with the federal government to do that in a reasoned way over time, so that we could do it in a very positive way and take the existing resources and reshape them to where they need to be. I really do think that disability rights is the civil rights issue of our time, and we're all going to be able to be part of that. So that's very, very, very positive. So getting down to the ground level, what does that mean? I think it means that as we move forward, we're not going to be developing any more buildings that are all people with, not just with mental illness, but not even all people with disabilities. We're really going to be developing integrated housing. And on top of that, it's not just the integration, it's connecting people to the community support so that they could really integrate into the community, addressing the stigma issues that Fran was asked about earlier today. And I think that's going to come down to, again, joining networks and not just thinking of supported housing as the housing, but as you're an integral part to the community integration. You're the eyes on a daily basis. If a person doesn't make their medical appointment, you'll know that probably before their care manager does. If they start having problems and they're not doing well, you'll probably pick up on that. So you need to be a part of that to keep the people in the community. I think the challenge is going to be especially with the capital financing, how we develop a business model that works, because supportive housing, especially with capital attached to it and with tax credits, brings a lot of resources to a housing project. And I think one way we're addressing stigma is we're bringing resources to the table in mainstream affordable housing for people with disabilities. And how do we work with the federal government to say what a reasonable mix is in a building? And that's going to be the challenge moving forward. And I was again pleased this morning that the leadership of the administration is going to take a leadership role in that conversation with the federal government.
Jason, if you wanted to.
I think I agree with everything Bob said. I think that it's Olmstead is an opportunity, but it's also a challenge. Because we've grown supportive housing all across the state, and now the idea of having to sort of shift to somewhat different models is scary. We don't, I think, want to, throw the baby out with the bathwater in an effort to get to more integrated settings. We've got a lot of lessons learned, a lot of very successful projects that we want to continue. And I think we also need to think about how, when I think of supportive housing, I think obviously the biggest challenge we have is we just don't have enough, the supply issue. And I think there's sort of two ways we have to address that, and it's consistent with how we meet our Olmstead requirements, which is that we need to obviously increase the physical capacity, we need to build more buildings, we need to develop more projects, but at the same time, we also need to address the demands issues, which is we need to find more creative ways to transition people from supportive housing into alternative settings when it's appropriate. Now, I'm not saying that some people supportive housing is the housing they need to be in, but I think we need to get more creative about how we can support people in a scattered site type environment, and make sure that we can bring other housing supports, other housing type programs to the fore as well, so we can sort of create this greater continuum of options for people. Because at the end of the day, I fear that we aren't going to be able to build our way out of the current challenge, and so we're going to have to find some way to address it on this idea about a continuum and people sort of being able to, on their path to recovery, move into alternative housing settings.